Reopening the state economy means trying to balance concerns of employers, workers, and consumers. When Governor Baker outlined his plan for a multi-phase reopening, some advocates and state legislators call for delaying the start and providing more say in policy decisions for workers. Among them is our guest, coordinator of the Transnational Brazilian Project in the Mauricio Gastón Institute for Latino Community Development and Public Policy at UMass Boston. We'd like to welcome Eduardo Siqueira. Thank you very much for being with us, Eduardo.
Thank you, my pleasure.
Eduardo, I'd like to start with some of the workers in Massachusetts that maybe you're familiar with and who you're most concerned about with the move toward reopening. What can you tell us about those workers?
I'm very familiar with the Brazilian immigrant work population, for example, but that affects also other Latino, Hispanic workers that are now called essential, that have been exposed to the virus in many different situations, including the workplaces where they work. And we don't think that the protection that's been offered has been good to prevent that the virus continues to spread as it has spread in those communities. And our major concern is that these workers or representatives of these workers were not at the table to discuss within the committee, the panel that the governor assembled, what were the precautions or what were the protective measures that must be in place to make sure that workers going back to work in non-essential jobs are protected enough not to recreate or reestablish the chain of transmission of the virus as we've seen before. So our concern is that the state is not prepared yet. It's too early to reopen these businesses without the preparation needed to make sure that we're not going to have another peak of the disease as predicted by every other major source of research, epidemiology research. Folks who are deeply concerned with the transmission of the virus have alerted us that we should be careful on how we reopen. We don't disagree with being phased reopening. It's clearly this is a correct way to do it. The question is, what do you have to have in place to make sure that even at phase one, you have enough to guarantee that as you reopen, you're not going to actually recreate the situation that in the first place spread the virus without control.
What I'm also thinking about here is that you can have one standard that's practical for a big company with a centralized workplace like Amazon or Walmart. But what about small businesses or people who do house cleaning? What should the standard be for them, especially around something like testing?
That is the problem. We don't have enough testing, and it's very difficult to control the spread of the virus without knowing who actually are the carriers, especially those who don't have the symptoms of the disease. For those who have the symptoms, it's easier. And if you're talking about small businesses, they need a lot of help. Some of the help will be providing them, they're supposed to provide the PPEs according to the regulations of the country, which means OSHA has to be involved in giving the guidelines, specific guidelines, which they have been involved, but not enough. The guidelines of CDC kept switching back and forth, being downgraded. And I agree with you, if you have a centralized workplace, it's easier. But assumedly, what all workplaces have to do is what we call an infection control system in the workplace. Some of it may be easy. It's a matter of figuring out how many people you can allow in at a given time, how you're going to keep the physical distancing in the workplace. These are not very difficult measures. But when you're talking about equipment, such as personal protective equipment, masks, respirators in some cases, gloves, disinfection material, that requires some planning. And that requires infrastructure that I don't think a lot of the small businesses have. So when we say too early, it's also because we don't have yet the number of people that need to be in place to do the so-called contact tracing, which is highly intensive in labor, in people. You need to have a lot of people trained to detect the cases, the symptomatic case and the asymptomatic case as early as possible. If you don't do that, you will actually allow the virus to spread as happened in the past. And if you reopen now, you're not going to see the effects of this within the next 3 or 4 weeks, because this virus moves slowly but one person can infect many. And especially in smaller spaces, indoor spaces where you may not have, for example, good ventilation. In some cases, you're going to have to look at the workplace, and the owner will have to say, how many people can I have this at one point? Can I open the windows? Can I increase the ventilation so that I actually exhaust the possibility of the air being infected by the virus? Because one of the misconceptions that are still very prevalent is the idea that this virus is not really an airborne virus. It's just droplet. That is false. And now there is new research showing that super spreading is what really is very concerning. For example, if you are in churches and you have choirs and people start singing, as you have many people doing this in a given space, enclosed space, without proper ventilation, there is a very fast spreading of the cases. So it's not really only one person spreading, but if you have many people assembled in a space for a significant amount of time, it's not going to be 1 minute or 2 minutes, but in a given workplace, people work with each other for many hours. So if you have places, for example, where people sit down in a given restaurant for hours, and if you don't have good control, one person can spread the whole virus for everybody who is in that restaurant. So we are concerned that these kind of preparations need to be in place. People would actually have to drill this. That's what we always say for firefighters, for everybody, every environment. You have to have regular periodic drills. So the small business will have to actually be trained on how to do it. And that takes a little bit more time. And not doing this before certainly will expose a number of immigrant workers, low-income workers, folks who live in communities that also have a higher number of people infected. They have less an ability to self-isolate if they are at home. So if you put all that together, you are actually not prepared if you don't have a good sense of how you're going to control all these environments where low income, especially, and small business, many of them are also low capital folks. So all those conditions make a situation complex. And I don't think this state is prepared to do this.
As you know from studying the migration of hazards, they can move in multiple directions. They can come from the workplace to the home or vice versa. But speaking of homes, there's a correlation between poverty and more human density. So how do you remedy that to isolate people? I mean, somebody's got to go live somewhere else, maybe?
That's one possibility, but fundamentally, you have to identify the cases as early as possible. And in those situations, and that happens with low income, we have a significant level of poverty and despair at this point. People are going to work even if they are symptomatic or sick because they need the money. So what you have to do is to create possibilities. Instead of only creating hospitals, new hospitals, you have to create new places for people to quarantine or to isolate for 2 weeks. And now that the number of cases decrease, the infrastructure has to move to provide temporary housing, temporary places for people to stay. In Chelsea, what they ended up doing is having a contract with a hotel to do that. You can do this with other places temporarily, but fundamentally, you have to do an early detection and early control, because we know that the progression of this virus is exponential. In other words, it moves very fast once it starts moving. One person can infect 3 or 4. Those can infect another 3 or 4. It moves very fast. So the sooner you establish the control, the better. This is why you should not rush to reopen, because in a matter of weeks, we may actually prevent a lot of cases if we do it correctly.
What about the mix of people who are close to the governor in setting policy here? We've been reading about this. There are some people with health or public health expertise, a lot of business people, but you say the workers need to be in there more.
The workers, those who actually know the day-to-day lives of the workers, from the perspective of those who actually will suffer the impacts. We know that the distribution of cases and deaths in this pandemic has affected African Americans a lot more than whites, Latino workers a lot more than whites. So you actually need to have those folks sitting at the table so that they can actually say what we need to make sure that there is prevention early detection, early treatment, because this is what we're going to have to do, not in the next week, not in the next month, for a long time. It would be self-defeating to open fast because business are putting pressure, and then within a couple of months, which probably will happen, it's likely that this is going to happen, we're going to have to shut down some sectors of the economy because of the spread of the virus. And it's just a matter of figuring out with folks who actually know the day-to-day, because if not, it becomes too much business interest first and not the health of the people first. I'm not opposed to have this negotiation, that dialogue, but the folks who actually should be at the table to negotiate this and to give input to the process were not. A lot less people than needed representatives of these groups were not invited, were not part of the decision making. Now, what we have to do is to show how these decisions do not take into account the interests of workers, immigrant workers, low-income workers, etc.
You probably saw the photo on Twitter of the crowded Silver Line bus in Chelsea recently. What does that make you think about what needs to be done for the MBTA so we won't have too many hazards migrating on the T?
I believe we have good examples already in New York City. I believe the Governor Cuomo is giving the nation a very good example of how to deal with this. Part of it will be scheduling. Part of it will be very good disinfection. But part of it will be actually, as other countries are doing in Korea, in China, you actually have to have a massive system of testing people. You have to measure their temperatures. You have to reduce the number of people in each car. You have to change the scheduling of workplaces so that we don't have an agglomeration of people. If the business cannot do this by themselves, there should be some planning. An individual business will not be able to do it by itself. It's got to be a combined conversation between the workers and the business to figure out, for example, staggering, rotation, reduction of agglomeration in given shifts. And that has to be programmed and planned. And as I said before, it has to be drilled. People have to be trained on how to do it so that they understand the best way to preserve their family's health, their business's health, is actually to do it in a way that is actually under their control. Because my major concern with all this pandemic is to be ahead of the virus. We have been running after the virus from the beginning. We continue to do this. And if we continue to do this, we pay a higher price. More people die, we have more cases. And studies now are showing that if we did it weeks before, if we took some of these measures weeks before, we would have prevented a number of cases, thousands of deaths and cases. Recent publications just showing simulation what would have happened if you did the controls a couple of weeks earlier. So now we're in a similar situation. What would happen if you control earlier instead of later? And the cases that we are seeing in other states in the country where the reopening was done without the 2-week period of decrease of cases, without controlling the spread of the virus, you are actually recreating all the situations that generated the crisis. We now have less cases. Yes, it is true. The curve is flattening in Massachusetts, but not yet with all the conditions that we need. The number of people testing positive, for example, is not yet low enough. So there's some precipitation. I believe Governor Baker didn't do as good as a job as many people claim he did, compared to California, compared to Washington State, compared to other states that did a better job. I believe he was still a bit too loose in when he established the measures, and now he's been too loose again.